I was at a conference once and somebody was talking about the efficiency and how we needed, cost of healthcare. So really, to check flexion, just have the person squat. And I thought, it matters to the back where the motion comes from. It matters that hip flexion, if that person's limited, if their hip flexion is like 70 or 80 degrees, the rest of that squat's coming from their back. So with our tools and our ability, it's important to identify the difference between hip flexion and hip flexion with lumbar flexion. So you have, if you flip the page, you have those pictures and they're right next to each other. This would be, the spine there is symbolizing a back that's in neutral. And so if you have your hand behind their pelvis on the PSIS, I get to a point where they've had a certain amount of motion, and then I feel the PSIS start to move. And if I keep going, I can get their leg up higher, but I'm getting it up higher from the lumbar spine having flattened. So the difference between that position and this position is the back flattening. That's not a straight leg raise. Now that's a straight leg raise with lumbar flexion. So now we're going to look at measuring hip flexion with a knee bent. And so the spine in this position is to symbolize a neutral back, and your hand would be underneath the PSIS. And if you go further, if that's it, if that's all the hip flexion they have, you'll feel the PSIS come down onto your back, to your hand, excuse me. You'll feel the PSIS come down onto your hand with movement from the back. So actually, this is their hip flexion. This is hip flexion and lumbar flexion. So we're going to look at hip adduction, which is done with the back in neutral, and you do take the leg and put it all the way down to the mat. Now for most people, again, like I said before, most people, their back is going to be extended, is going to no longer be in neutral. But for right now, it's the most consistent measurement to take. Okay? You have to tell people that they might have an arch in their back, because when you remeasure them, they might actually have the same number, but it's a sign of an improvement, because if that back is no longer tilted forward, if now they're in neutral, the ASIS has come up closer towards their chest. So maybe the insertion can't go further, but the origin has changed position. So when you at least comment to somebody, when you're taking their measurement and you say, I know that your back is arching, but for consistent measurement, we're going to use this position. But do know that as that gets better, we might remeasure and you get the same number, but actually it's a sign of improvement if your ASIS and your pelvis and your back are in a better position. Okay. So in this case, you're going to have the person in neutral as much as you can. You'll put their leg down straight. And when you bring their leg into adduction, you wait until you feel the pelvis start to move. If you don't stop there, you're going to get hip adduction and lumbar lateral flexion. So when you're taking your measurement, if you don't stop where the person's pelvis starts to move, your measurement's not hip adduction, it's hip adduction with some lumbar lateral flexion, which may be the cause of their pain. So it's kind of a significant thing to identify.